t-shirt.
Family, the son now runs it.
आपको ड्रॉप भी करना है? वही मैं पूछता हूँ उसको कितनी देर लगेगी यहाँ? अगर यहाँ इसको आधा घंटा लग गया तो आपका वो वाला ड्रॉप का क्या हुआ? यहाँ ले लो।
I think I'm saying new and it's not. Namaste.
Namaste, you were pronouncing right.
I would hope I would be going. Yes.
Yeah, this will come in your video.
So we are here at Artemis Hospital. My name is Fabio. They cut my hair. I used to have long hair, and I gained a lot of weight. You never heard of Fabio? No. Oh, yeah, famous singer and actor, yeah, in the U.S. Yeah, ladies like him. His name's just Fabio. No last name, but I joke. My name is Brian. I'm from the U.S. And the Artemis Hospital, a very, very high technologically advanced hospital. My room, wonderful room. Vaulted ceilings with molding, crown molding around the ceiling. Floor to ceiling windows. I've never seen a hospital with floor to ceiling windows. And I know the gentleman holding the camera, Mr. Kuldeep Chaudhary. Chaudhary?
Yeah.
Put the camera on yourself, Kuldeep. Take a bow. Take a bow. He is very, very good. He helped start this hospital 5 years ago. Say hi, Kuldeep.
Hi.
So he is my new friend here. I come by myself from the U.S. No family, but they are my family. Him and Yosh.
Hello.
And they take very good care of me. I'm in pre-op. The red circlet says fat chicks. Chicks is girls, you know. And a line for it. Higher than your hip. Yes. That means you're not going less than a 90-degree angle. So it doesn't matter what you're. That's difficult because so you have to have something to hold on to as you lower yourself. So that is what walkers are for, I guess.
I'm in the room 2401 at Artemis Health Institute. A patient, Mr. Kim Brian Erickson, who's flown from the state of California, United States of America, is about to be discharged today. He has undergone a total hip replacement surgery which has been done by Dr. I.P.S. Oberoi, one of the most renowned arthroscopic surgeons in India. Mr. Kim Brian flew into India about 8 days back. He drove from the airport straight to Artemis Health Institute, and the next day morning the surgery was done. Mr. Brian had sent his MRI reports from the United States of America, and on the basis of those reports, a semi-hip arthroplasty was planned. When he landed over here, seeing his discomfort, Dr. Oberoi had some doubts, so some x-rays were done. On plain x-rays, it showed that the extent of the damage was much more, and he, instead of a semi-hip arthroplasty, he actually needed a total hip replacement. Let's ask Dr. Oberoi, what exactly is the difference between the two procedures, and how difficult and challenging was this case?
Is it Brian, he had been in a hip damage for roughly 5 months or so, and he had been limping. The leg had become short quite a lot, and the pain and discomfort was quite extensive. The muscles had become weak, and as the time was passing over, the ball damage had actually hit into the socket, and there was a rent into the socket. So only doing a half hip replacement would not have worked. We would have need to do a total hip replacement, wherein we need to change the socket also and the ball also. And the surgery extent actually becomes nearly double, because instead of dealing just with the thigh part, we're actually dealing with the acetabulum or the pelvis part also. In addition, we had to restore the leg's length equally. The leg was short by around 5 centimeters or so, and the hip had actually climbed up quite high. And we had to bring that hip down and reposition it in a normal anatomical manner so that the hips are okay. If the hips are up and down, then your gait would never become good, Brian. So that was a challenge. Second challenge was because it was lying quite high up, it was all surrounded by scar tissue. It's a fibrous tissue, which is hard tissue. It bleeds quite a lot. The moment you touch that scar tissue, it bleeds, because it is one which doesn't contract. Normally when you cut a muscle, it contracts and it stops the bleeding. But the scar tissue is one which is very hard tissue. So the moment you cut into the scar tissue, it starts bleeding. To bring and remove that all scar tissue, unless and until you remove it, you can't make the hip flexible. And then to change the entire socket, because the socket had rent, so we had to bone graft that socket. And we were lucky, we got bone from the head of the femur, the thigh bone. And that head bone was your own bone, so it actually is compatible. So it heals well, it is 100%, it takes well. And then we fit in a socket, it's an uncemented socket. Now this is a socket which has got a calcium coating on it. So it's going to fix with your bone very well. And we, in addition, fixed it with 2 screws on.
Oh, okay.
So that's a well done socket.
Yes.
And into the socket we were able to place a polyethylene. So that's a poly cup, which is a very high density poly. You can bang over it, it doesn't break. So that's a high density poly which has been tested again and again.
Is it comes in the box with
It's come in a box. It's a
with
different
the
sizes.
balls?
Yeah, different sizes. All
Right, matched to the diameter of the ball?
Yeah, the outer diameter of the ball actually matches with the inner diameter. So there's no chance of it to dislocate. Unless and until somebody just holds it and actually pulls it out. It doesn't happen in the normal.
And then there are how many screws holding the socket?
Usually the socket has 4 screw options to be put.
Holding the polyethylene plastic in?
Absolutely, but we tend to put only 1 or 2 depending on, I mean, you were lucky, your bone quality was still pretty good. Maybe you were eating well and you were trying to manage well, yeah.
Lots of good vodka.
Oh, maybe, yeah, that's a challenge. So with the bone graft and your host bone, which was also good and healthy bone, we were able to fit the socket. We were able to bring your femur down, replace the ball, equalize your limb lengths, and were able to move your hip to the extreme range of movements on the table itself. So we ensured that you were able to do most of your activities which you want to do later in your life. Once you tend to develop good muscle control, and once you tend to develop a good power in the hips. You see, just replacing the hip is not the solution. We need to work out to make your thigh muscles better.
Sure.
If the muscles are weak and you have a new ball and socket, it doesn't work.
Right.
You need to have good muscles. And then educated muscles, which means how to walk, how to bicycle, how to climb up, how to climb down. And this would be the next challenge now. We have to work hard on you, on rehabilitating you well. Because to get back into the way you were doing before, I mean, you are a skier.
I did not know it because my doctors tell me, oh, it's probably some tendons or ligaments or a bad. I need total hip, or at least partial hip replacement of the ball, and they would put a titanium rod down my, and then it would probably cost nearly $150,000 in the U.S. Being self-employed, I cannot afford my own health insurance, so I must pay for the surgery. My patients that have come to India and have been very happy with the quality, which is the most important, but also the cost is very, very reasonable. He told me he recently had a patient come here and have a knee replacement, and it was less than $10,000. Visman from Placerville near Sacramento, California, and I talked to him over the phone, and he gave me your website, healthindia.com, easy to remember. I immediately went to the website, Health Institute, here in Gorgan, and the price was going to be $8,500. So very, very reasonable. Less than 1/10 of what it would cost to to have this done in the U.S. The professionalism is not to be questioned. They're every bit as professional as any doctor, surgeon, technician, nurses that you would find in the U.S. The surgeons, the doctors, the technicians, the nursing supervisors, they all speak very, very good English. You know, the testimony firsthand from a neighbor, this Mr. Mark Visman, even though I've never met him, I've talked to him many times over the phone, but he told me how well you treated him. How I found Artemis Hospital to be, oh, the rooms are nice as a hotel room. Oh yeah, I felt like you and your associates, I did not need anything. You were there in pre-op, you were there in post-op surgery, and you were as my companion, you and your staff. So it was very heartwarming. You treat me like family, and I will always be very grateful. So I will come back to this country and see the rest of it in time. It is very beautiful. The people are very, very wonderful. But you know, it's a lot better than carrying a broken hip around.
So you don't need these things now, other than the physiotherapy.
So I throw the crutches away.
Wow.
I hear buzzing in my ear.
Is your hip?
Oh, hip hip hooray!
Brian, look here. So you are now about to go back?
I can walk now.
Wheelchair to Delhi.
A lot better than when I came in 3 weeks ago. 3 weeks ago Friday.
So you don't need these crutches now?
I just take them back with me. If I get tired, I get tired.
Yeah.
I get tired every once in a while.
In 1 month or 2 months time you'll be all right.
Yeah, I think so.
Yeah, you will.
So
So when are you coming back to visit us?
next time I need surgery or something,